We are very excited to share our 2015 statewide medical and health exercise. This week-long exercise included unprecedented planning and participation across the state of California. Preparing for the exercise and testing our processes helped us to document statewide policies and procedures for any infectious disease or bioterror incident and strengthen our response relationships for all types of emergencies, which is truly priceless.
It's like a football team. You don't walk onto the field at game time and introduce yourselves and say, hey, what do you do? No, we need to have the ability to know who the players are, how we're going to communicate, how we're going to coordinate, who's going to do what role, who has what responsibility, and how we're going to make this all happen.
Hospitals throughout the region no longer can keep up with the long lines of sick patients.
We've come a long way in 2 years. We've replicated what it's taken some areas 5, 6, 10 years to do.
It's great to see this type of collaboration working at the local, state, and with our involvement federal level.
So really, it's learning how to respond, who to talk to, and to do it in a place where we don't actually have lives on the line, and to be ready when we do.
You train like you play, and you play like you train, so that way you can learn from any mistakes or learn from any positive things that you also do.
On November 19, 2015, agencies across the state of California participated in the annual statewide medical and health exercise. This annual training and exercise program is part of a larger effort sponsored by the California Department of Public Health, CDPH, and the Emergency Medical Services Authority, EMSA. This program is designed to help healthcare, public health agencies, and their partners exercise their response to unusual health events that may challenge their facilities, personnel, and impact the communities they serve. This statewide undertaking begins with the Statewide Medical and Health Planning Work Group, who began producing exercise materials in December of the previous year. Hundreds of hospitals, health departments, and healthcare facilities across the state used these templates to create their own training and exercise programs. Almost 2 years before the exercise would take place, CDPH assisted in the creation and facilitation of a regional working group called the Southern Regional Public Health Exercise and Emergency Response Committee, or SRFR.
Back in September 2013, we began the monthly planning process. We brought together the planning partners throughout Southern California, and then we began the monthly meeting, establishing the relationships and the planning that would take us to the exercise.
One of the key initial meetings was the health officers' facilitated discussion that helped outline the scope of response plans, policies, and procedures.
The purpose of today's events is to bring the health officials together to discuss common ground. How can they collectively respond to an anthrax event that's going to impact almost 20 million people within this jurisdiction?
What's going to save people's lives is how quickly we can get the pills to them and they can get the pills into their systems.
This exercise really helps us prepare by meeting our partners personally. It's really discussing areas where we would need mutual aid and answering the same questions, being on message.
To have this kind of connection with the health officers, the planners for emergencies in our various health departments, we have great confidence that down to the level where we're actually going to respond, we're going to be able to pull this off really well.
This is our first operational briefing for the MHCC.
We are responding to an anthrax attack that has spread over the entire region of Southern California.
Biological collectors have detected the presence of Bacillus anthracis, the bacteria that causes anthrax. Rapid administration of the antibiotics can prevent the disease in individuals who have been exposed.
11 Southern California counties and 13 public health agencies joined together to conduct the state's largest bioterrorism drill.
The exercise is performed every year to test our ability to respond to emergencies within the state of California, anywhere from communicable diseases to, in this case, an aerosolized or weaponized biological terrorist attack.
What we're going to see today is how the information process is starting from the initial phone call alerting people about the emergency to what we can do to prepare the general public to know what to do, where to go, and how best to solve part of this problem.
It's helping us build a stronger and more responsive California Health Alert Network. We're going to learn more about which delivery methods people actually respond to the quickest, whether it's text messages, email, phone calls.
The purpose of this exercise is to go ahead and practice what we have in formal policy, identify our data gaps that we have, whether it be in communications, logistics, as well as to train different people in different roles, ensure we have continuity to ensure that we can go ahead and get the resources and manpower and expertise out to the people who are affected by the incident.
CDC was requested and agreed to provide these life-saving medications to the state of California. We found that starting these medications within 24 to 48 hours of exposure greatly decreased morbidity and mortality.
One of the main objectives of the exercise was to test the timely distribution of medical countermeasures to the public within 48 hours.
We have had functional exercises which have tested various portions of our plan. This full-scale exercise today, we're putting that all together to ensure that we're able to meet our objectives of providing these medical countermeasures in a timely fashion.
Our main purpose is to see how fast we can receive drugs and how fast we can ship them out. Each 1 hour we'll send out approximately a million courses of therapy. Since this is one of those cases for anthrax where the drugs need to get to the people as fast as possible, we're going to be cross-docking.
Instead of taking the shipment down and putting it in the individual shelves or racks, we actually stage it as if it's an entire truckload. So we're receiving an entire truck and then we're sending an entire truck out to get the prophylaxis out to the population.
We have 7 affected areas right now, 2 cities and 5 counties. Those cities are Pasadena and Long Beach.
Long Beach is a city of 450,000 people. This gives us an opportunity to have our staff get involved, let the public know about the types of response resources we have available.
So this is our form. We want to know if they marked all no's, any yeses.
As a point of dispensing manager, my role is to ensure that the operation runs smoothly. Everyone is aware of what their role is. Dispensing med eval is still going to be Eileen, and we get people the proper treatment as soon as possible.
All the rest is no for sure, right?
That's right, yeah.
Okay, go ahead and take your screening form and your information sheet back to the dispensing table. Thanks for coming.
It's going to be this side of the paper right here. You want to take 1 in the morning, 1 in the evening, 2 a day for 10 days.
This will help us to ensure that we have everything in place. It will also show us what needs to be improved, what we are doing well.
We can certainly take back that there is needs for other languages. That's good feedback.
The exercise included the initial notification of the presence of anthrax in the region, the request and receipt of medical countermeasures from the CDC, the receiving and shipping of these supplies to local health departments, and the distribution of the supplies to local partners and the public through the use of point-of-dispensing pod sites.
As an environmental scientist, I could be called on as a subject matter expert for this kind of stuff. So in observing this will give me a better idea of what exactly is required.
After years of planning and a full week of realistic play, the exercise was deemed a huge success, the largest and most inclusive effort by far as part of the statewide medical and health exercise program, and the largest participation in the exercise across the state. Thousands, if not millions of lives could potentially be saved as a result of the quickened response times achieved and lessons learned by all who participated. In the event of a real anthrax attack of this size and scope, each hour of delay in response and distribution of medication could result in an additional 1,800 cases.
For me, knowing that we've got a shared understanding of how we would operate during an emergency like this informs a lot of the other conversations that we have. It's a very collaborative state. We each have our own areas of responsibility, but it really helps when we actually understand each other and we're working in a coordinated fashion.
This exercise is more than just quicker detection or medication shipment times. The relationships that were built or strengthened among the participating agencies ultimately make a real-world response more efficient and effective, preparing us for any disaster or attack that comes our way.
I think that these exercises are absolutely essential for the day when it's something this big, this statewide.
In a real emergency, we'll be ready.
We've planned this for years, but until you actually start moving boxes and pallets and everything, you really don't know if the plan's going to work, so this is going to help us in the future.
It's been a great experience. Couldn't ask for a better set of colleagues to work with. It's really done a lot for our planning, both state, local, and some of the private entities that have participated. We have learned an awful lot from this exercise. Positive experience all the way around.
The California Department of Public Health and the Emergency Medical Services Authority would like to thank all of those who made the 2015 program such a success. We encourage our public health and medical response partners to use this program as a chance to make our state better prepared. The lessons we learned are invaluable because when the disaster hits, we are going to need to know how to work well together.